So Jennifer, the other day I met somebody you know. His name was Marcus. He was telling me about his journey and how much you helped him, how much his life transformed. It was a pretty cool story, but he mentioned in it about how the way he got help was through Still Winds Ministries. It's like a scholarship program. Can you tell us a little about that?
Yeah, so Still Wind is a nonprofit organization that was established out of some dissatisfaction and discouragement in the mental health system, which I'd love to teach you about today. And what Marcus was telling you was how he would have fallen through the cracks had it not been for this private and public collaboration to form the scholarship program, which now helps many people like Marcus and other people who are going through life transitions be able to access the kind of mental health services that they need.
Tell us about those cracks in the mental health system that you first noticed and how you noticed them.
Yeah, well, there is the public mental health system and then there's the private mental health sector. So when I left college, I was, super ambitious social worker and so excited. I was really going to make a difference in my community and loved psychology and started working at public mental health in child and adolescent services, worked with families and children. A lot of them had chronic and severe mental illness for many generations, and so there was not a lot of change, but a lot of support and a lot of maintenance. And I felt like I kind of wanted to do more than that in my career. I wanted to kind of impact the community that I lived in, and I learned that specialists, people in mental health who really focus on a particular type of treatment, they work in the private sector, and specialists get to work on problems through to a solution. So it's not focused as much on maintenance and support, but it's focused on actually resolving mental health issues. And so I decided that was going to be the thing for me, and so I jumped out into private practice, and about 2 years in, I realized was not going to be as great as I thought, because I found people falling through the cracks there as well. And those cracks were, like Marcus's story, when people would change jobs or they would get divorced, or if they had to have a medical procedure and all their co-pays were going to other outpatient services, or if they were insured but underinsured and had a really high deductible and they really couldn't afford the mental health treatment, or one story that I like to tell is about this client that I had who was really struggling in life, had challenging children, marriage was suffering, and had a chronic illness as well. So I was working with her and I was helping her manage all of this. She was making a lot of improvement over a few months, and she was able to get a new job, which alleviated some of her financial stress. But when she got a new job, her insurance changed, and that insurance was not in network with me, and so she had to then pay out of pocket for therapy, or the only other option was that I had to reduce my fees, which I couldn't afford to do. So we had to end therapy, and she had a choice of either starting over with somebody new or quitting therapy altogether. And so that was really discouraging and kind of dissatisfying for being in the helping field. And there were many people like that kind of kept happening, and it felt like there was punishment for her getting better. She was not able to continue with the care that she had benefited from in order to get the new job. So that's kind of led to me complaining, probably to anybody that listened to me complain about these gaps in the mental health system. And I happened to be complaining one day to some people who had also noticed it and had become discouraged, and they were actually thinking about starting a nonprofit for mental health counseling in Greenville. So it turned out that they invited me to come and develop the clinical program, and that nonprofit is Still Wind. That's where the scholarship fund began about 11 years ago now.
And so how does that work? Can just anyone get it? Does it pay 100%? What's the process for that?
So the Still Wind Scholarship Fund is to help clients continue and complete their therapy. And so it's for people who can start therapy, who can pay to begin, and that they can contribute something to their therapy sessions. But also what happens is the therapists get paid their full fee. Okay, so the scholarship will cover the amount that the client or the insurance cannot cover. And so it's different than a sliding fee scale. And what someone has to do is they have to really seek out therapy because they want it anyway. And then if there becomes a roadblock, like a change of jobs or a divorce or medical procedure or some situation, like in Marcus's story, he was laid off. If there becomes a situation, then the scholarship allows them a resource to continue and complete their treatment and avoid the disruption.
So it kind of supplements to fill in the gap so that the person can actually finish and, like you said, to actually fix those problems like you mentioned a while ago.
Yeah, so I realized too that in specialized counseling, some is kind of equal to none. And so to really start working on mental health and then having to quit is really not much better than not starting it at all. And so that's really one of the gaps that Stillwin Scholarship Program fills, is it helps people complete it. You're right.
What kind of things, you mentioned like specialist, when you're saying that, what do you mean? What kind of things fall under like a specialist category?
So the world of psychology has evolved as much as all the sciences because of technology, and so there are many different modes of therapy, and for different issues, there's highly specialized modes of therapy for OCD and for PTSD. And specialists who tend to work in the private practice setting, they will focus on one particular mode and get really, really good at it. And they can focus all their resources kind of on that population and on that problem because they're not working for an agency, so they don't have to, help whoever comes through the door. They're not limited by the kind of rules and regulations of the agency. And so it's a really vital part of our mental health system that the public and the community is not really aware of.
So I know Marcus benefited from that, but how many people do you think have accessed that scholarship fund since you started it?
Yeah, so we have been offering it for about 11 years, and we've given away tens of thousands of dollars in scholarship. As far as people, it's probably been a few hundred people that have been helped, and on average, scholarship pays 15 to 40% of the cost. So let me give you an example of one person that wrote a note about how it helped them. They wrote, "Dear donor, I am so thankful for the help that my family received through the Stillwin Scholarship Fund. I'm a single parent with 2 children, and I work as an educator. See, all 3 of us need emotional and relational help, but I can only afford for one of us to go to counseling. Because of the scholarship fund, my whole family and I can receive therapy separately and together. We are so grateful to have a chance to be happy together." So that's kind of an example of the kind of people that use the scholarship fund. Is they're working, they don't necessarily have a lot of discretionary income at the end of the month. And so they obviously have other doctor bills and other co-pays to pay. And copay is $25. So if you have 3 people in your family and they need to come 3 times a month to therapy, now you're at $75. And if they need to do that for 9 months, for a single parent, that's a deal breaker. And so that's where there are cracks in the mental health system. And there are therapists who try and fill those gaps. And being self-employed, we can't afford to slide the scale enough times in order to really make an impact in the community. And the community is contributing now to helping our teachers, our neighbors and our friends become mentally healthy.
So Jennifer, a lot of people ask me about sliding scale fee, but what you're talking about is really different than a sliding scale fee, right?
Yeah, the reason that we do a scholarship program instead of a sliding fee scale is for our professionals. Mental health professionals in the private sector are self-employed, and they have at least a master's degree and a certification that they have to keep up. And on average, they make $40,000 to $50,000 a year. And so the number of people that a therapist can reasonably reduce the rate is a really small number of people. So therefore, the impact on the community is hard to measure and even hard to notice. And so we want to support our mental health professionals because they're already giving to the community in their profession. We don't want to take money out of their pocket to help the community. And so that's why we have developed the scholarship fund, which allows the public to participate in having a mentally healthy community. And a public can pay $25 for a person's session. The therapist can get paid their full rate, and the client can pay what they can afford. And so that's the difference between the sliding fee scale and the scholarship.
Yeah, because I think it puts the therapist gets in a dilemma with the sliding fee scale, because they either have to see a massive volume just to be enough to pay their bills,
right,
which results in, just to say it frankly, insufficient care.
Right.
Then you're still stuck in that other mental health system.
Right.
Right. Or they can only do it for just like 1 or 2.
Right.
and you get stuck.
Yeah, and it's difficult for a therapist to decide whether they do it for this person and not that person, and it can become an ethical issue that we wanted to avoid.
And so how is the scholarship funded? Where does that money come from?
So it's public donations. We have community partners. These are people that are in Greenville who know the value of mental health and have the desire for Greenville to be a mentally healthy community, and they give monthly to the scholarship fund. And so we spend right now on average about $1,000 a month in scholarship, and it's funded by our neighbors and our friends.
Do you have to give monthly to the scholarship fund? When you say monthly, is it like a recurring thing, or?
People can give however they want. I mean, they can give one time or they can give monthly. We give money away monthly, right? So, but it's how, in whatever capacity that somebody wants to contribute to mental health, they can give one time or multiple times.
When you look at Marcus's story, you can see how that little bit of help, it didn't just help Marcus, but how that's impacted everyone around Marcus and then the community as a whole. So it really multiplies the effect, I guess I would say.
Yeah, so mental health is a vital part of the community and the conflicts that we're experiencing in any community. And so I think that helping one person, even the story of the educator with her 2 children, right? How many children is she educating that because her family is helped and happy, then she's a better educator to 20 other people's children, which then those children are happy because they're being educated well. So it has exponential impact.
So if somebody wants to donate to the scholarship fund, how do they do that?
So you probably know someone who would love to do therapy but runs into this cost barrier, and you can click our link below at stillwoodministries.org and find out about how to donate, and you can even donate there.